All right, welcome back. Now, a lot of people, they come outside complain about our health institutions for inside Obodo, Nigeria, and also complain about the doctors, the nurses, and every other person where they actually give us health services, healthcare services. Now, imagine if you get an organization where rather than complaining, that they actually help to make our health professionals very, very kajad. Well, that's not what you could get today on Top of the Morning Show, because we get a kajad doctor in the house, Dr. Yewande Oguntoyibo, and she, now the program's coordinator for Integrate Integrity. They will tell us more about them. Good to have you in the house.
Good to be here. Thank you.
Just quickly tell us about Integrate Integrity and what you they do to actually help our health professionals in Nigeria.
Okay, well, Integrate Integrity is a non-governmental agency, it's a non-profit based in the U.S. Professionals from the U.S. have come together to try and support the health system in Nigeria. We're trying to support both the public and the private health sector. Our aim is capacitation, and capacitation, it means helping, encouraging, supporting in any way that we can. We can support materially, we can support with training, we can support with linking them up with people in the US that actually can help whatever it is that they're doing. So that's our goal, and our goal is to make it not just one section of healthcare, but as much as we can influence. It's quite a heavy task where we won't do, but we will try. We're trying.
Yeah, it's good. It's always good to, you know, it always fits my belly when I see people, they come Nigeria particularly to come help, particularly healthcare, education, excuse me, healthcare and education are two sectors where we know say really, really need servicing and need help from within and from international community. But one question I want to ask, why would I pick Nigeria particularly?
Well, among the directors of this organization, all of us are Nigerians. And because we reside in the US, it's very painful for us to experience and see what is going on in Nigeria. We have relatives, we have friends, we have people that are here, and a lot of them are not getting what they need. Many of them that can afford to go abroad to spend a lot of money without having follow-up, and at the end of the day, some of them still die because they are not being followed up. So it's very frustrating for us, and a lot of people are beginning to give back whatever it is you can do to help the sector, and that's what we're trying to do.
You know what, I like what Bernard talk. I like when you see like Nigerians abroad coming back to give back to the society. But looking at the healthcare sector, we actually carry on a survey to find out the loopholes where the health sector for entire Obodo, Nigeria, they get as regards to professionals. Because just over the weekend, I see a lot of doctors coming out to talk, say, we are not well paid, we are not well appreciated. Is having the right facility or the right education the thing which our doctors need?
Well, it's not only doctors that we're thinking about the health sector as a whole. But the truth is, a doctor or health professional that is satisfied at their job is more effective. Whether it's money, whether it's the drugs, whether it's the equipment, whether it's the training. So we're looking at every single one of those areas. And we are doing studies. We are going to different places to find out what is it you need here. We are ready to support you in what exactly it is you need. We can't meet everything, but we'll do what we can do.
What if they want to go abroad? Because I don't see a lot of doctors coming out to say, don't train me yet, I want to go abroad.
Well, you know, the going abroad part, we're not into that. Good. What we want to do is we want to do it here.
Mm-hmm. I like that.
Yes.
Okay. Very quickly, I always ask, when I see non-profits, as you mentioned, as you call them, here they call them NGO, non-governmental organizations. Okay, but all the same, when I see, you know, these kind of organizations come into Nigeria particularly, say they want to help our people, they want to do great things for this particular country. One question people would always ask is funding. We know, say, whatever it is you want to do, you would spend money no matter how little. How will they get to our funds?
Well, we're all volunteers. Every one of us as directors, we're volunteers. So we give of our own time, we give of our own resources, little that we can. But in the US, we're able to go to organizations. For example, we go to an organization and we say, we're going to Africa because we want to support this. They say, they give us equipment, they give us materials. We've actually had American physicians come to these local health centers to come and do whatever little they can to try and help. So people are willing. Once we can connect the people that are willing to them, to the people we want them, you know, so that's how we did do them.
All right, so how do you identify these local health centers? Because looking at it, you know, they actually deal with communities. How you say they find them?
Well, we find them through Nigerian physicians and Nigerian healthcare professionals. It's not difficult for us to find because it's like everywhere needs something. It's like there's been almost no place that we have interacted with that doesn't have one need or the other. So getting the places is not the problem. How to meet the need is bigger than us. So we're encouraging other groups like us to come and to do this. This is the time for us to begin to change the face of healthcare. People don't need to die unnecessarily. People don't need to be incapacitated unnecessarily. People don't need to go to India, and I have nothing against India.
No, I do too.
They don't need to go to India for what we can do here. And many times, when people go, they go that place. When they come back now, who will take care of them?
It's still the Nigerian physician.
It's still the Nigerian physician. And if they don't know whatever they did for them over there, it gets more difficult.
Very true. Let's talk about the success story so far.
Okay.
Like how many professionals you don't actually help?
We have helped quite a few. Actually, this trip that we're on, we're going to train in Lagos here. Okay. We're going to have a training tomorrow. Tomorrow is Tuesday. Yeah.
Oh, tomorrow.
We're going to have a training. There's one actually going to run today at one of the hospitals in Lagos, a private hospital in Lagos. But the one on Tuesday, we're going to have professionals from Unsuka. We're going to have professionals from Luth, Lasuth, Ilorin, ABU, about 6 hospitals all over the country. We're going to have them. We'll sit together and we're going to train them, and we're also going to interact with them. But we're talking about diarrhea in children and how we can help to get rotavirus is one of the causes of diarrhea. We want to get the rotavirus vaccination on the protocol for Nigeria because it's presently not on the protocol.
Okay, interesting.
Yeah.
So far, what do you feel talks be your major challenge?
Hey, we get some challenges.
We know the challenges go there.
It's always there.
But if you can pinpoint, say, 2, 3 particular ones where you know, say, be the real stumbling block, like they call them.
Yeah. Well, one of the things, like we had talked about before, is that many people, professionals, they're just looking for what can benefit them. Yes. Many people want to travel. They want to go abroad. They don't want to focus on what is here. That's one thing. The other thing is that when we come like that, they see us and they're like, are you trying to tell me I don't know my job? So that has been one of the problems that we've come. The other thing is the system here, things don't work automatically. You have to know how to manage, how to mix the system together in a way that will work for you. So that has been a little challenging, but you know what? The challenges are there, but we've had many successes. So that makes it worthwhile.
That's a good one. That's a good one. I also want to ask, did you practice in Nigeria here initially?
I did.
For how many years?
About 2 years in all.
Before going abroad?
Yes.
And for how many years have you been in practice now?
A while.
Okay.
I'm very young, but it's been a while.
Okay, that's nice.
Would you blame our government officials for deciding to go abroad for treatment?
That's a very difficult question because when it comes to you, you want to think about the best way that you can help yourself. It's difficult because the system is over here, you are not sure of what you're getting. So it's a very difficult question. I would rather they didn't, but for now, it's what it is. We hope it can be better, that will not be a need in the future. So we're hoping that the young people and the people that are already on ground, we can encourage them to do what is right to improve the system here. We have very brilliant minds in Nigeria. Really.
I tell you. And these health professionals, are they well trained? You know, the reason why I asked this question, now because a doctor tell me, say, the training we receive here for Nigeria is totally different from the training we received there overseas. Especially now looking at our educational sector, like Bernard talked earlier. You feel, say, we are well trained, especially our health professionals here in Nigeria?
Well, I would say we are well trained. I will put that in quotes. We are well trained in patient care. Even over there, people know that Nigerian trained physicians are very good in patient care. Why is that? Because, for example, for me, when I got to the US, was the first time I saw some of the equipment. I never saw it before.
Wow, you can imagine.
Never saw. Never used
For
it.
2 years working in Nigeria.
Yes. So in that area, when it comes to technology, there's a lot of things that really need to catch up. But patient care, we're very good.
When you say patient care, what do you mean by patient care?
That means interacting with the patient without any equipment, without anything. We know how to do that. But the equipment, we're still trying to catch up with that. Yeah.
And that's serious.
Yeah, that's serious. Yeah. We really need to step up.
Yeah.
Let me put you on the spot now.
Okay, sure.
If, first of all, this visit when I don't come now, how long have you been in Nigeria for?
Oh, we're here for 6 days in all, and we're going to 3 cities.
Oh, 6 days.
When did you arrive?
Cities.
Last night.
Last night. Oh, so it's still early for me to ask this question.
Yeah, it's all right.
Maybe if to say you come on the last day now for this question for even suits me, but I will still ask the question. I know that you they follow recent happenings in Nigeria, particularly now. I'm sticking with health sector.
Right.
If by any stroke of chance, let's just play into the future small, you were made the Minister for Health in Nigeria, I would like you to mention.
That would be great.
It would be very great.
Very.
For the fact that I don't interview you, I know say I go there aside. Okay, we go there.
You are thinking like a Nigerian now.
I'm telling you, must you benefit from it? Must you benefit from it?
I just said we will be here by her side, though. I didn't say we will collect anything.
Okay, we'll support you.
We will support the ministry.
Right, that's what we need.
Exactly. My question is, if you are made the Minister of Health, what will be the things, the first immediate things where you would like to look into right now concerning health sector in Nigeria? If picking one is too challenging, let's make it 3.
Okay. One of the things that definitely for me as a person I would look at is what is it that is killing Nigerians unnecessarily and what can we do about it? The second thing is why are we not retaining our professionals and what can we do about it? The third thing is how can we make our health centers better, more effective to support the people, and cost-wise, how can we bring down the cost? So those are the 3 things I would focus on personally.
Let's break it down.
Okay.
Number 1, what would be your number 1 point?
I talked about things that Nigerians are
Killing
dying of.
Yes.
Now, talking about that, a lot of things, they kill Nigerians. Now we see cancer. Cancer don't become like the order of the day. In a day, you must see like 20 people where you go come outside talk, say, I have cancer. Diarrhea too, another one. Measles too, another one. Malaria too, another one. Just give me, there are a lot. We see the monkeypox too, which is another one again.
That's very new.
So you see, there are a lot of things where they kill Nigerians. So how person go fit actually help as regards to that?
Well, with that, you will look at preventable. What is it that we can prevent? For cancer, I would say we can't really control that much, but other conditions like diarrhea, we can prevent it. Talking about the vaccination, we can prevent diarrhea in children as much as possible. We can teach health education. We can teach hygiene and sanitation. We can teach things to mothers. We can teach things to people in school such that they will be able to help themselves. We can teach first aid. There's so many things that we can do to prevent simple things from killing people unnecessarily.
I actually like that. Now you actually give 3 points. We get 2 more points to go where we go actually analyze.
Okay.
But we're going to need to buy a small break. And when we come back after the break, we go get another member of the Integrate Integrity joining us in the house to discuss more about how to make our health professionals, they're very cardiac twins, how we do Nigeria. Stay with us, not go anywhere. Thank you.
My people, una good morning. My name na Ali Baba. I say make I just wake up this morning, make I greet una. As una day this morning, so may God they bless una banga go ripe. As it be so, una no go use leg, knock stone when go cost una wahala. The stone when una go kick, na the one when go make una get better money. You know, say them talk say if you use right leg kick something, better they happen. Una left leg no go hit waiting go make una disturb una self. And I do greet you now. Una well done. Una they watch this good money show. May God bless all of una and una banga go right as I talk. Now Alibaba say make I greet una so. Carry go.
Now welcome back to Good Morning Naija show on this Gangshos Day, the 20th, Monday the 20th of the month of November. Now if you not just join us, you don't miss a whole lot. We don't be the talk to Dr. Yewande Oguntoyinbo, and she will tell us a whole lot about integrate integrity. Now we've been telling her say another Kajat guest will also join us. Yes, that's Dr. Yewande on the screen right there, and she don't give us so much information. In fact, our belly don't fool, we don't belly fool. Dr. Faith Njoku also don't join us. She'll be the second Kajat guest in the house where we talk say, go join us, ladies and gentlemen. Viewers at home, we're going to join us to welcome Dr. Faith Njoku, also of Integrate Integrity. Dr. Faith, you're welcome.
Thank you.
Yeah, you go follow us speak pidgin. We don't want what you want to have.
Because now she get the Oyibo well.
Yes.
The Oyibo is there.
All right, so Dr. Faith, basically, we don't discuss plenty with Dr. Yewande. She don't tell us about what Integrate Integrity intends to do, which una they do already, and which una plan say una go do, the number of cities we una go visit, and waiting the whole initiative they about. We want to hear from you. We know say you don't day abroad most of it. First of all, have you practiced in Nigeria before?
No, I haven't.
At all? Okay, certainly not. So
Yeah.
from what you've been hearing, from what you've been seeing over the media, sometimes even though we are media, we know say sometimes some things where you see for television, no be waiting you will experience for Nigeria. Now, what are the major issues where you as a person feel say you want? We know what she don't tell us the aims and objectives of where una don't come, but what are some of the major issues where you feel say you fit contribute to concerning this particular visit?
So some of the issues we've been noticing, honestly, have just been in regards to the access to technology, access to training, and access to international research collaboration to put Nigeria's healthcare sector on the map, both the private and the public sphere. Those are some issues that we've started noticing are lacking here. So at this point, we're trying to really aim towards enhancing that international research collaboration with partners abroad in the diaspora and here in Nigeria. We're trying to enhance the training for medical students, for residents in Nigeria. And we're also trying to raise awareness for some of the more preventable and non-communicable diseases that are sort of afflicting Nigerians at large. So those issues are large in scheme, but we have a very strong, passionate team of healthcare providers, both here and in the diaspora, that is helping out to get that mission across here.
Now, you talk about technology. Now, one of the things where Dr. Yewande Dokumasai talks, say a lot of our health professionals here, they're not exposed to technology. So how you want to help them as regards to technology?
So I completely agree, and that's one of the core fundamentals of this organization and this mission. At this point, raising awareness to increase access for technology here in Nigeria, it will require collaboration. It will require partnership with institutions abroad that have already established themselves. As Nigeria is continuing to develop, the healthcare professionals that we've interacted with thus far are brilliant. Once they have that access to the technology, there is nothing that will stop them. So I think that the one thing we need to start working on is just collaborating on an international scale, working with physicians abroad who've already established some type of technological innovative practice that can sort of expand to what we can do even here in Nigeria for both the private sector and the public sector.
Let me quickly ask, for how long have you been practicing?
I am actually still in training, so I am not practicing yet.
Not practicing yet.
I'm still in my training, yes.
Okay. Now, I want to ask this one's to you, Dr. Yewande. You said that you will not practice for 2 years before eventually going abroad. What was the reception like? In sociology, they call it culture shock. When you got there, how What be the things will surprise you, first of all, and what the differences as to, of course, I know say traffic go different from there as the people here, but of course, not talking about that. What was the reception like? What did you notice?
And you'd already identified, say, technology meant having access to some kind of equipment was totally different. Yeah. So other things.
Well, one thing I know is in Nigeria, training in Nigeria compared to over there, it's like over there were a lot of assumptions. They assume that you're familiar with this, they assume that you're familiar with that, and there were some things that I was not particularly familiar with. So that was a little bit of a stumbling. And then the other thing is that, you know, we're Nigerians, we go with this figure it out kind of thing. There were a few things that I thought I had figured out, but when I got there, I was like, oh my, I haven't figured it out at all, and I need to really relearn it. So, but apart from that, it was pretty smooth. It was pretty smooth.
I like it. Now, talking about integrate integrity, now as you come outside talk, say you need to do collabo with a lot of institutions abroad. Now, don't actually, have you practicalized that collabo on our health professionals here?
Yes, we have the pleasure and the privilege to work with one urologist and kidney transplant surgeon from the Cleveland Clinic. His name is Dr. Charles Maudlin. He came back home with us this past summer. He was here for about 2 weeks and traveled to some of the sites we're working with now. We're trying to develop a renal transplant program for Nigeria.
Oh, in Nigeria?
Yes.
Wow, that's really good.
Yes.
But trying to develop, I'm sorry, just trying to develop, and what's the challenges? Because I know, say, for a very long time, doctors abroad, they come outside to the federal government, say you need to actually reduce the fee where would they pay on equipment. Because having a Euro center for inside Wobudo, Nigeria, it costs a lot as regards to equipment. So what will be most of the challenges we're now they face?
So the angle we're taking now regarding this transplant program is based on the idea of using education as a platform to create change. We're working now with the private sector here in Nigeria and the public sector. So there's one doctor, Dr. Bamboye from St. Nicholas, who has been extremely helpful and very open to collaboration as well. So as we do see challenges in terms of getting access to this technology, but the primary goal now is to lead in the education training, lead in research. And from that research, we will start to talk about how to get access to the technology. Whether it looks like exchange programs here versus going to the US, we need to start sort of bringing the healthcare professionals in Nigeria up to a different level with specialized training, specialized surgical trainings.
Now, we know, say, Dr. Iwande don't mention before, say this is a non-profit, but I would also like to ask, is there presently or will there eventually be, or are you looking at any government involvement?
Let Dr. Iwande answer that.
We definitely are looking for government involvement. We want the government to authenticate what we're doing. Authenticate means to let everybody know that this is real and this is to help everybody in a way they the country. The other thing that we want to do is when the government comes in, they put in laws and rules and regulations, they help to support the growth. So that is one area. Now also, the government does have some funding. So if government comes in, that is also a source of funding for helping the system that's already here.
So how will all this, we integrate integrity, how it go take help us for inside Wobudo, Nigeria? Apart from the fact that you're training the professionals, how will it help us? How we could take benefit from this?
The population, the people are the goal. It's not even just the healthcare professionals, it's the people. At the end of the day, if you help the healthcare professionals, you make them more comfortable, you make them have the things they need, you make the government supportive, the public sector supportive. At the end of the day, the people are the ones to gain. If the health centers are better equipped, if the people working there are happier at their job and more effective, everybody benefits. So it's a win-win.
Now let me talk to Dr. Faith. Now, a lot of people behind the scene, they're very concerned about doctor and patient relationship. Now, we don't go, I have been opportune to be with my younger sister when she was giving birth in the hospital. And the way the nurses, they tell us, say, we did that when you did one with your husband. Come on, open, come on, do this one. In short, to an extent, one of the nurses hit her leg. You understand? So that she go open And then you will see some doctors just come in, lackadaisical attitude, just come in and say, okay, you don't give her drug, you don't give her that one, okay, you'll be fine, and then just let her go. How now we take train our health professionals to be more, I don't know, more empathetic in their dealings?
That is a wonderful question. I have had the pleasure of working with or speaking to one group in Abuja, and they work primarily with entertainment and education, and they term it edutainment. And they use that platform to sort of convey how to speak to patients. So they'll have actors and actresses that are conveying that, and vice versa. Patients are more aware about the basics about malaria or vaccinations, and that taboo is now gone. So although the goal is to try to help and try to work with as many people as possible, but we'll always have those that will maybe slip between the cracks and may have a bad day, or, you know, you never know what will take place in those settings. But raising awareness, using social media, you know, mobilizing individuals, trying to train them and teach them in a way that they can even understand, I think that's the first step. Because as Dr. Yewande mentioned, people are the ones that will benefit.
Very true. Dr. Yewande, does that happen to abroad? If a woman is giving birth, they go to shout, say, come on, open, don't close it, open. And in terms of patients and doctor relationship?
Well, you know what, people are people everywhere.
Oh, so it happens everywhere
well,
too?
It's not the order of the day, but it does, just like she said, somebody might be having a bad day. Somebody might be going through something. The patient themselves could be difficult. So it could happen, but there are regulations and there are like checks and balances in place to reduce the occurrence. And that comes from education too. It comes from education and it comes from oversight. If you know that whatever you're doing is either being watched or is being evaluated, you behave better, you know. So,
and here it's not being watched or evaluated.
Well, I don't know to what extent it is.
Exactly.
Yeah. So.
Well, thank you so much, Dr. Yewande Ogutoyibo and Dr. Faith Njoko, all from Integrate Integrity, a non-governmental, non-profit organization where they actually help to train our health professionals here in Nigeria. Now, if they want to contact you, are you online? What's your online presence?
Yeah, we are online. We have a website called
IntegrateIntegrity.org.
IntegrateIntegrity.org. So I beg if you actually contact them on top there. And if you want to actually support them by funding, like Bernard, they always talk about funding, please go to their website. Thank you so much. And we wish you all the best. Thank you.
To enjoy more of these our Ogbonge videos when you just watch, press this button to subscribe on top of our YouTube page. You go love her.